Hello everyone, welcome back to my channel. Happy New Year, happy 2024. Thank you so much for 1K subscribers. We are 1K family now and it's so amazing. Thank you so much for watching my video. Thank you so much for commenting, for sharing, basically for the engagement. Thank you so much for always watching my videos. So my name is Tabiramu Samantha, a registered nurse, and on my channel I share everything nursing, health, lifestyle, and blogs. And if that is the content that you love to listen to, the content that you engage with, feel free to subscribe. Feel free to press that notification button so that you don't miss out on any of the videos that I post. Today I want us to talk about the elephant in the room, which is nurse bullying. This is a very huge problem that we have in our profession, and it's becoming so toxic that some people are actually leaving the profession. Some people are leaving their jobs. Like, we can pretend like it's not there, but it is actually there. I have been in this profession for a few years and I've met really amazing nurses, but I've also met terrible nurses. Like, I've also met terrible nurses, like people who are bad. But people are generally bad. Not everyone is supposed to love you, not everyone is supposed to like you. However, I want us to dive into this topic. Let me share some experiences. Let's talk about it and we see. Let us see why it's done, who does it, and how you can maneuver your way around it. Let's get into the topic. So some people consider nurse bullying as like a regrettable yet unavoidable behavior that is in the nursing profession, which is very true. Like every other profession, there is bullying, but there is just this toxicity that is just there, and people think that it's unavoidable, but it can be avoided because of bullying. Nurses sometimes are leaving work. There is absenteeism because if I'm not enjoying my job, if I know that there is toxicity at my place of work, why would I go there? Then there is low productivity because if I am bullied every day, I will not give my best. I will not give the patients will not receive the best quality care that they are entitled to. And then there is also medical loss of medical expenditure because these hospitals are going to lose staff. It has been estimated that 34% of these nurses or health workers consider leaving their job or profession because of bullying. And this is all labor being lost every day because of bullying. But then, what did you get from bullying someone? May I think bullies like they're so insecure. I mean, no one is going to take away what you do. That's the first thing. You have to be so secure in your job that you know that no one is going to take it away from you. You have to treat people well. You have to teach people well. People forget that we are growing old. Every single day you're growing old. But if you're not training someone to get into your shoes, you're going to have the same people taking care of you, the same people giving you health care. And if you have not trained someone, you're going to complain about the health care. So I think if you're in the position where you can train someone, you can supervise someone, do not demean them, do not yell at them, do not belittle them. This all puts someone down, and I think it's all forms of bullying. So I have seen nurse bullying in different forms. I've not seen the physical bit, but I think some people go there. But I've not seen physical where someone physically attacks you and you start fighting. But I've seen yelling in front of patients, in front of your colleagues. You people, that is bullying. Why would you yell at me? Like, I've seen this mostly in supervisors, or people may call them preceptors, but supervisors and students. Sometimes these students come green. They don't know anything. They don't know how to cannulate. They don't know how to give medication. They do not know calculation, which grams, which milligrams. They know nothing. And their supervisor is supposed to teach them. But you find these people trying to help out, and someone is yelling at you, belittling you in front of everyone. I wouldn't want that to happen to me because I would prefer you to call me aside, correct me, like, you know what, this is not how we do it, this, that, and that, and that, so that I can know what to do the next time. But you find a nurse seated in one place and just yelling at students the whole word, and then you're like, doesn't she get tired? Does it, like, sometimes when I'm on those words, I'm like, doesn't she get tired of yelling? And what I've also discovered is when you teach these students, when you call them and you're like, no, and when they ask you, because most of these students have questions, but when you look at that nurse and she's yelling at you from the time you came up to the time you're leaving, most of them don't want even to know what is happening. Most of them will tell you, this course, I think I chose the wrong course. Because of the way that you're treating them, there is this barrier. They cannot approach you freely, they can't ask you questions. And remember, they have come to learn. So how are you going to teach people that you're yelling at every day? Then another thing I've also seen is belittling. Like I've seen this in newer nurses and older nurses. Now the older nurses are those ones that have been in the field for a long period of time, and then they see Samantha coming in with my degree. You know what? And I put on my scrubs, my Crocs, and then you meet a nurse. She has a cap on, she has a white dress on, and before you come, you're the .com nurses, and then you're like, hello, good afternoon, good evening. My name is so and so. I'm the new nurse. I'm an intern nurse. I've been allocated on your unit. First looks at you from head to toe. First of all, I do not know what's happening. I don't know if it's insecurity. I do not know if they think like you've come to take their job. But there is a way these people, first of all, treat you in a very different, like they treat you like you're not part of them, which is not good. Like, I mean, why would you treat me like I'm not part of you, yet I am a nurse? So belittling, like speaking to you harshly. And if you're speaking to me harshly in front of maybe a patient, how would a patient trust me to work on them if you've showed them that this nurse doesn't know anything? I would prefer if I don't know something to teach me than to belittle me, than to tell every Tom, Dick, and Harry that I don't know anything. I would prefer for you to teach me than to belittle me. Then there is also minimizing you. Like people just tell you like suck it up. This is also what we went through. Like then there is also name calling. You know my name. Why wouldn't you call me by my name? I would prefer you to call me by my name than labeling me as a bad nurse, something nurse. No, call me by my name. If we have issues, call me. Let's sit down. Let's talk about them. Let's sort them out. I prefer that. Then there's also people ignoring your calls for support. What I mean here is, you know that you're supposed to work with me on ward, and then someone just disappears on you. They don't tell you where they're going, they just disappear on you. And you end up having a ward of more than 30 patients. You're supposed to give them nursing care for all of them. And then you end up working day shift, evening shift until you're handing over to the evening person, which is not good because there is a patient who is very sick, I'm going to give most of my time to that patient, ignoring. Not that I want to, but I will unintentionally not give care to the other patients, which is not right. So I do not know what people call this, but I don't think anyone should tolerate this. So I put together some of the reasons why I think there is a lot of bullying in nursing. And if you have more reasons, I think we can discuss, put them in the comment section. Let's keep the discussion going. And my first reason is insecurity. I think the nurses that you find there, I'm not going to sugarcoat it. Now, nursing is an evolving profession. It is changing a lot at a faster rate. You will see a lot of the products, I mean the nurses that are coming out nowadays, and their mindset, their way of thinking, it's different from the nurses that have been in practice 20 years, 30. It's different. The way we think, the way we look at things is different. The way we approach care, nursing care is different. Because we have we are learning these new technologies and we know how to use them. We are vibrant and we believe in collaborative working than working alone. We believe in inclusive working, inclusive quality of care, giving quality of care to patients than you working alone. And I feel like these nurses look at you, like the older nurses look at you as a threat. You're out of school, you're fresh out of school, you come. First of all, I have seen that the people that are the nurses that I've come out of school with, we don't have any issues with each other. If there is an opportunity, I will share it with you. If I feel like that's not for me, I'll share it with my other um, BSN nurse because that's us. like they're teaching us like you have to work together, not competitively. Okay, the competition is that good competition is good competition, but I mean this competition where you don't even want anything good to happen to the other person. So I have seen this insecurity between the older nurses, the ones with more experience, the ones who feel like nursing is their thing and we are just invading it. So they feel like you are a threat. First of all, you're going to come, you're very young, they're going to give you a position that is higher than them, that is already going to get you into trouble. So they're going to look at you as a threat because you're coming in to take their jobs. But then that is not always the case. I'm very, very, very interested in finding out the new skills because these people have been on board for a longer time. They know the different skills, they have the experience, and they can teach you. But then, if they're looking at me as a threat, meaning that knowledge is not going to be given to me, it's going to die with them. And that is where I go back to my point that I said at the beginning. If you're not passing on the knowledge, whom are you going to give it to? I'm the same person who is going to care for you. So if you're not giving me the knowledge, if you're not passing it on to me, which care are you expecting from me? So when I talk about burnout, a lot of medical professions know what I mean by burnout. Now, burnout is more mental than physical because you're doing procedures first of all for a long period of time. You're on your feet 24/7. I'm giving an example of an ICU nurse. You have a full bladder, you haven't eaten, you're on your feet 24/7, you're tired, you're caring for this patient. ICU, remember, there are no attendants. So you are basically looking after a patient. You are feeding the patient, you're giving bed baths, you're turning the patient, you're making sure the patient's vitals are okay, you are assessing the patient from head to toe. Remember, for us to look at the nursing, everything from head to toe, everything. Have you seen a baby? Now, a patient in ICU is like a baby, but remember, this patient is sick. You also have to be taking care of the medical bit of this patient. So by the time this nurse leaves, they are like moving zombies. They have been working now. A nurse who has been in working in ICU for over 5 years of their life is like a moving zombie. They are tired. They're irritable. They are just annoyed. They are just annoyed. Now you're bringing in a nurse like me to train, to guide, to supervise. There's going to be a lot of displacement. First of all, some of these nurses when they come in the wards, they want to do their work and go to sleep if she's working night shift. She's working day shift, she wants to do it as soon as possible to go to another place of work. Because here in Uganda, nurses are working 2 to 3 jobs because of the low pay. And that is also affecting our quality of care to our patients. Because if I'm rushing throughout everything, I'm not teaching if I've been given students to teach. I am not giving full or quality nursing care to my patient because I'm rushing to another place. So you realize that there is going to be a lot of rudeness and displacement. Displacement from home. From where? From where? It's going to come back on you. She's going to shout at you. She's going to be rude to you. So you end up saying, oh my God, this nurse is bad. But sometimes the burnout gets to them. People, burnout is real. People get breakdowns. People get mental breakdowns. I remember there was a time I was working somewhere for, I think, 2 years, 3 years. I'd not got a break. I reached a time and my body was just telling me I can't do this. But I had to go to work. Like I was like, Samantha, go to work, go to work. I remember I started telling my mother, I can't do this. I just don't want to go to work. I can't do this. And it wasn't that I didn't love work because I was just out of school. I wanted to work. I still want to work. But my body was just tired. It was just tired because you're on your feet 24/7. We're not like doctors where you sit down and write and write. No. By the moment you sit down, by the moment you sit down and start documenting what you've done on a patient, someone else is calling you. So that is why I always also advise nurses when you've just done something, document it. Done something, document it. Don't let the whole thing pile up because you may not have the time to go back and write everything. So burnout is real. It affects you here than the body. If you don't have a strong mindset, most people leave the nursing profession because of that. Another point that I may talk about is personal issues. You people should know that nurses are human beings. Before someone becomes a nurse, they are someone's daughter, they're someone's wife, they're someone's sister. Like, we hang out. And if you've been watching, and if you've been a subscriber, you've been watching my channel, you know that I love going out to eat. I love doing different activities. And that's what people forget. People forget that when you become a nurse, you're only a nurse. No, people have personal issues outside the hospital, outside the NGO, outside where she's working. People have personal issues, and some people may not be able to separate their personal and professional life. So you have to be mindful of whom you're working with. And most people have faced this, not even when you are an intern nurse, even at your places of work. The people who are above you, let me say your supervisors, your nurse managers, your in charges, they may not even be there half of the time. And now me, I knew stuff because when you're studying, they take you to hospitals and then you do some malpracticing. And then when you come out, when you're waiting for internship, you can, volunteer here and there. So you have some experience, you know what to do. So, but I'm talking about a student who doesn't know anything. So you have supervisors who tell you, oh, my mother died, my child is sick. I have, you even hear some say, my marriage is not doing so good. I'm not going to come tomorrow. My husband has come. I have to go and cook for him. Those excuses are there. People come to them to work. And some people, if things are not going great at their place, at their homes, they want to bring that to work. So someone is not going to be there to supervise you. Someone is not going to be there to guide you, to teach you, and you have to learn these things on your own, or you may not learn them. So you have to be mindful. Some people, you may say that they're bad nurses, but they're still human beings. And some people become rude because of the issues that are home, their personal issues at home. And I give people benefit of the doubt unless you continue doing it. My supervisor did, but she was the sweetest person. I still go back, I still say hello, I still WhatsApp her. She was one of the sweetest nurses. She was never rude, but I'm just giving you like the examples. People come with them to work, and some people can't separate the two. So you have to be mindful, you have to be patient. That's it. Okay, those were some of my examples where I think some nurses are rude. But I would love to tell you guys that if you're put in a situation with a mean, a disrespectful nurse, do not be afraid to put your foot down. I know there are different upbringings, different teachings are also, but the different teachings contribute a lot to how someone behaves. I've noticed that too. Different teachings contribute a lot to how someone behaves. I repeat that again. Um, if you look at a person who has been, I'm sorry to say this, but I've seen this. I have seen this during my internship. I'm still doing internship. I have seen this. Students from nursing schools are kind of timid. I'm not saying it in a bad way, but they're kind of timid. They're afraid to say things. I don't know why. They're afraid to say things. Like, if they may even see like something is wrong, they may be treated rudely. Not by only by nurses, I've seen even by doctors, and they're timid, like they keep quiet. But it's not the same case with a person from a university, a nurse who was trained from a university. I'm not saying it in a bad way, but if you look at nurses from nursing schools and nurses from universities, you will see that there is a big difference. Even the way they approach, even the way they assess the patient, even the way I like they just come, let me say, and then look through the file. Oh, let's go and give medication. But when I come on a patient, I don't want to just give medication. I want to find out what is wrong with the patient. I want to find out, apart from the medical diagnosis, what else is wrong with the patient. I want to find out other aspects of the patient's problem, which is not the same. And I've also noticed that with them, they're the ones that are yelled at mostly. They're the ones that are name called mostly. They're the ones that are being minimized. They're the ones that are being belittled. But that is minimal. That is minimal, the other side. And I am I have met some rude nurses, and I've not been afraid to put my foot down and tell them, you know what, if you feel like I am lacking somewhere, if you feel like this is not the right way that I'm supposed to do this, I prefer for you to teach me than to yell at me, than to talk to me in a certain way. Because yes, you're my supervisor, but I'm also a human being. So I have not been afraid to tell them that, and we have we have gotten off in a rocky start, but we ended on a good start because I'm a kind of person who would prefer to talk to me than to yell at me, than to gossip about me, than to backbite me. No, I would prefer us to talk about it. So if you're in a situation where you meet a bully, don't be afraid to put your foot down. Another thing that I would advise nonsense is if you are working, if you're already in a system, wherever you are, as long as you are practicing nonsense, and you start facing these things of bullying you start facing unfair treatment at your place of work. You people, there is something called an administration, there is something called your supervisors, your managers. If the bullying is not coming from your managers, from your supervisors, go and report this to them, inform them, document it, tell them, you know what, on such and such a day, this is what I went through. My mom always says that get out your story before the other person goes. Because let me tell you something, I can tell you something right now, and before it reaches the third person, the story is already changed. So go report this case. By the time they call the other person to give their side of the story, you've already given out your case. Than waiting for this person to go there and start telling another different type of story. There should be zero tolerance of bullying in your place of work. So report, report, report. A toxic environment is no place for us to be working when you have people's lives in your hands. So guys, you don't tolerate some crap. Do not tolerate people treating you in a certain way. Bullying affects us mentally and physically. Protect your mental health. You people, you may think that this is little, but the words that you tell someone, the way that you treat them every day, people have feelings. You may think that, oh my God, I am feeling so good. I'm feeling so good about myself. But the impact that you're putting onto the other person is affecting them greatly than you can imagine. So let's be mindful, step up, put your foot down. A toxic environment is not a place for us to be working. You are a nurse and you're needed everywhere. Let me tell you something, nurses never run out of job opportunities. It's you who will say, those people pay me less. No. But nurse jobs will never run out. So I tell people, do not settle. I have people say, oh my God, a job? Jobs are hard to find. People do not settle for a job where you're ill treated or it's a toxic environment. Let me tell you something. I was working somewhere and we used to work. First of all, it was low pay. We were honest people. And then it reached a time, I think, they wanted to reduce employees. And instead of telling people, like, you know what, here are the letters, this, and that, and that, and that, there was just this ill treatment that was happening, the backbiting. There was a lot of gossip, not this gossip, I mean accusing people of nasty things. And someone would come in early in the morning, a manager would come and tell you, is this the time you're supposed to come? And you look at her, because I was leaving around 9:30, depending on how many patients were having that day. And she was leaving at around 3 p.m. So I would look at her and I'm like, does she expect me to be at 7 a.m., 6 a.m.? Yet when she's leaving at 3 p.m. and I'm leaving at 9 a.m. I played chill. I was like, okay, okay, okay. But then there was this, like, it became so toxic with the words that were going around, that there was this whole thing of dismissal. I remember I went back home one time and I told my mother, I don't enjoy working at this place anymore. And my mother told me, what is the problem? Because the first time that the first time that I went there, oh my good Lord, I felt so happy. I felt like this is the place for me. I've met my people. We are going to work where we are going to give the quality of care. We are going to work collaboratively with the surgeons here, with the doctors here, with, like, I felt so happy. And the months that followed, I would look forward to going to my place of work. I felt so good. But there is a way that the switch just the switch just flipped, and it became too toxic to the extent that I would go back home and I had to check on my fellow, like my fellow workmates, like, hey, are you okay? You know what happened at work today? Are you doing well? I didn't enjoy going to work anymore. And I remember that time um going I was in two places, and one was so far. And what hurt me the most is I would try my level best to be on my duties. You people come to me and say, Samantha, you haven't been coming for your duties. But if I have been trying to cover my duties and you overlook that, and you just keep on treating me in any other way, I would say no. You're finished with this battle, another one starts. You're finished fighting with the medicine, another one begins for the money. You're finished finishing this, another one starts. It becomes so toxic. It becomes a very unhappy environment that I felt like my saving grace was my internship. I swear to God, I have this peace of mind. I have, like, I'm not worried that someone is going to call me and tell me, Samantha, you know, this and this happened. They're saying this and this, you did this and this and this and this and that. Like, we were grown up people, first of all. We were all above 18. We signed contracts. If I did something, if you feel like there is something I did, the least you could do is to call me, tell me this and this and this happened. We're doing an investigation. It never happened. Someone makes a final decision, and that is it, which was not right. But you people, there is so much you can do if everything has failed. If I remember talking to some few other shareholders, and they're like, you leave. You people, if things have failed, leave, look elsewhere, go for that plan B that you had, look elsewhere, because you're going to be at that place, you're going to sacrifice everything, but your mental health, it's going to reach a time and you're going to break down. I started not enjoying going there, and the moment that my mother told me leave, I think I needed someone to tell me leave, and I just left. Like, I just left after all that saga came in. This one's telling you that one's telling you that. I just said, you know what, let me just leave, because even if you fight to stay there, which happiness are you going to get? Are you going to be are you going to be so happy in your life that you're there? No. You're going to be working with the same people who are going to continue plotting against you. So what you do is leave. You people, you leave. There is so much you can do. If you feel like the environment you can no longer handle, leave. Thank you guys so much. If you're still watching the video, I've talked a lot. I don't even know what I've talked about, but I know the topic is mass bullying. So guys, all I can say is, if you have nothing good to say to someone, just say nothing at all. Just say nothing at all. If you don't have anything good to say nothing at all, because you may not be bullied, but you have children, you have brothers, you have sisters. Anything can happen to them, and you wouldn't want the bad things to happen to them. So let us do unto others what you would want people to do unto you. Thank you so much for watching, and if you like this video, don't forget to give it a thumbs up, comment, share. Let's share the video. Let's go to 2K now. Thank you for the growing family, and I'll see you in my next video. Have a good one.